Okay, Assalamualaikum and hi everyone. Today we will discuss about hijama or wet cupping for DPM 1062 communication skill. Okay, as I read in internet, uh, wet cupping is also known as hijama or medicinal bleeding, where blood is drawn by local suction from a small skin incision. The first reported usages are found in Islamic hadith, saying attribute to or describing the action of the our Prophet Muhammad sallallahu alaihi wasallam. Hadith from Muhammad al Bukhari, Muslim, Ibn al Hajj, Nisafuri, and Ahmad Ibn Hanbal support its recommendation and used by Prophet Muhammad. As the result, wet cupping has remained popular remedy practices in many parts of Muslim world. The best medicine with which you treat yourself is hijama, or it is one of the best your medicines, or the best treatment you can use is hijama. This is hadith from Sahih Bukhari, hadith number 5371. If we have headache, the solution is hijama. As per hadith, whenever someone would complain of a headache to a messenger of Allah, he will advise them to perform cupping. Okay, Abang Anwar, can you explain about what is history of hijama?
You. Thank you, Encik Ahmad. Okay, there is a growing body of evidence suggesting that cupping therapy remained an integral part of ancient medicine in one form or another. There are conflicting opinions regarding the pioneers of the ancient practice. Some consider the Chinese to be the inventors of cupping, while the earliest cryptographic records suggest that it is the ancient Egyptians who invented this technique at around 1500 BC. History connection between Egyptian, Chinese, Greek, and Islamic. The Egyptian connection, the Ebers Papyrus, one of the oldest medical textbooks, mentions the use of cupping by the ancient Egyptians for treating various ailments such as menstrual imbalance, weakened appetite, fever, vertigo, and pain. Moreover, drawings of cupping were also discovered on the temple of Kom-Ombo near Luxor. Kom-Ombo is regarded as one of the most ancient cities of Egypt. The Chinese connection the Chinese connection, history of cupping. In the Chinese tradition, the evidence of the use of cupping therapy can be traced back to the early Han Dynasty. Ge Hong, a famous herbalist and alchemist during the Jin Dynasty, is considered the first to use the technique in China. He strongly believed that with cupping and acupuncture combined, more than half of the ills can be cured. The Greek connection in ancient Greece, Hippocrates, a physician by profession and who is regarded as the father of modern medicine, used cupping therapy for treating internal disease and structural problems. Hippocrates recommend the use of cupping for treating ailments such as angina, menstrual irregularities, and other disorders in his guide to to clinical treatment. The Islamic connection in the ancient Islamic world, the term used for cupping was al-hijamah, and Prophet Muhammad sallallahu alaihi wasallam said to his followers, "Indeed, the best of remedies you have hijamah." Famous Islamic physicians such as Al-Zahrawi, at the 136 to 1036, Ibn Sina, AD 980 to 1037, and Abu Bakr al-Rizi, AD 854 to 925, described cupping site and illustrated cupping with diagram in many of their literature. Thank you.
It's very long history about the hijama, right? So we believe hijama have many benefit. Can Sister Diana explain what is benefit of hijama?
Thank you, Mr. Ahmad. Okay, as we know, the cupping is a lot. We have a lot of benefit of cupping. First, faster pain relief. Cupping can relieve pains due to arthritis and lower back pain. Other forms of pain that can be effectively treated with cupping included headache, migraine, dental pain, muscle pain, and sciatica. With arthritis, cupping is done with the constant joints. Cupping increases blood circulation and mobility. Therefore, it is an effective treatment for conditions like rheumatism, lumbago, stiff neck, and shoulders. Second, get rid of chronic fatigue syndrome. In our fast-paced world, there is a little time for rest and rejuvenation. Even if we find the time to take physical rest, we are mentally overloaded with digital distractions like smartphones and laptops. All of this can lead to chronic fatigue syndrome. This can be a long-standing form of fatigue. Hijama or cupping is an effective treatment for this condition. 3. Relief from lung disease. Cupping is an effective treatment for lung disease like chronic cough, asthma, bronchial congestion, and pleurisy. Number 4. Keeping the skin healthy. Often the health of your skin directly reflects what is happening inside your body. Cupping improves the skin blood flow and thereby increases the supply of oxygen and essential nutrients required for healthy skin. It is also helpful in reducing the recurrence of acne and other skin diseases like eczema and cellulite. Cupping therapy also helps to expand the blood vessel to facilitate blood flow and also remove toxic substances from the skin surface. Number 5. Relieving digestive problem. Cupping helps to relieve digestive problems caused due to chronic stress, malnutrition, or immune system response. Number 6. Healing urinary disease. Cupping therapy can be used for the treatment of urinary diseases like kidney stones, urine retentions, and abscesses. Urine retention is treated by applying the cups to the lumbar region. Number 7. A way of relaxation. Cupping also acts as a form of massage that provides relaxation. The energy and blood flow created due to cupping is a good form of relaxation. Number 8. Faster healing. Strategically using cupping can increase the blood flow to specific areas that need healing. The increased blood and energy flow will lead a faster healing. For most people, cupping therapy is a really great experience. There are countless health benefits for cupping. Also, it can be a very relaxing and relieving experience.
Oh, it's good to know so many benefit from hijama. I heard Sister Juliana is a hijama practitioner. Can Juliana explain to us how to perform hijama?
Okay, thank you Mr. Ahmad. Assalamualaikum warahmatullahi taala wabarakatuh. My name is Juliana, and for this session, I will share some steps on how to perform wet cupping to the patient. Firstly, make sure the surrounding area of the treatment rooms is clean. The therapy needs to wear glove and disposable apron. Among the tools needed in the wet cupping process are we need sterilized disposable cupping cup, suction pump, lancet pen, and disposable lancet needle, disposable bed sheet, gauze clothes, olive oil, distilled water, antiseptic liquid, yellow hazardous, waste bags, and yellow bin waste. Okay, before performing cupping on the patient, we need to take the details and history of the patient illness to identify the treatment concept that suit them and also to avoid any problem in the future. Alright, the patient needs to fill out a form giving consent to the treatment after they have been informed about the benefits and risks associated with cupping, because it can be considered a minor surgery by making a shallow wound on the epidermis on the skin. The surface of the skin to be treated must be cleaned first with distilled water, then rub with olive oil while performing a stimulation sequence on the area to be cupped. Before doing the first suction, apply alcohol wipes to disinfect the proposed cupping area. The first suction is created by the suction pump by placing the cupping cup and leave it for 3 minutes. Okay, enough time. Open the cup and quickly continues to make a small puncture using a lancet pad, then has been filled with the lancet needle. Punches are made at a distance from each other only on the area that has been vacuumed earlier. It should be emphasized that the puncture should be shallow and not deep, around 2 mm deep. Then, place the cup back on the pierced side and repeat the suction, then leave for the 3 minutes again. This time, it's aimed to remove superficial blood in the blood capillaries. Once again, after enough time, the cup is lifted slowly while wiping the blood on the surface of the skin using gauze. After cleaning, the suction vacuum procedure is done until we get a total of 3 suction sessions. With the same step, we leave it for 3 minutes. For this last session, clean the area with distilled water if there is any remaining blood, then spray it with antiseptic liquid. Patients are instructed not to wash the treatment area for the last 24 hours to avoid the risk of infection. Lastly, we have to make sure all the waste materials, including cups, and placed in clinical waste bags and cupping lancet in clinical sharp bins. Alright, that's all my explanation. I hope it will be useful. Thank you. Bye-bye.
Thank you for everyone to explain what is hijama from history, benefit, and how to perform. This is very interesting treatment that everyone should try. Thank you everybody and see you again. Bye-bye.
Okay, Miss Flo, how do you feel after do the hijama?
My experience after my cupping, my body feel better, and definitely I will do for my next season. Thank you.
Thank you. Okay, Mr. Ren, how do you feel after do the hijama?
Hi, thank you for having me. Actually, after cupping, I feel so relaxed and so already release my tension compared to previous one, and I feel my energy is full of energy after cupping. Before this, I'm so weak, and I think it's this good suggestion to others. Thank you.
Thank you. Okay, Along, what do you feel after do the hijama?
I'm feel better after cupping. I'm feel good.
Thank you.
Okay, thank you.
Okay, like, what do you feel after do the hijama?
Good, good,
Good.
good.
Bisa?
Yes.
Bisa English?
Now.
Okay, Ika, what do you feel after do the hijama?
Feeling orang.
What do you feel?
Alah, batal kan? Ikan nak
Jawab
solat.
Ika.
Nak jawab apa?
English.
Nak jawab apa? Macam mana?
How do you feel after do hijama?
How do you jugalah?
Okay, Rudy, how do you feel after do the hijama?
I feel good.
Feel good.
Yes.
Thank you.
Thank you.
Okay, Julia, what do you feel after do the hijama?
Okay. Apa yang awak rasa? Dia tanya okey lah. Good. Ya.
Good, thank you.